A foreign company may have world-class radiation equipment. The product may be advanced, the technology may already be trusted in other countries, and the demand in India may look very promising, but before radiation equipment can be sold, imported, distributed, installed, or used in India, one important question must be answered. Do we need radiation safety approval in India? This is where Raj's story begins. Chapter 1. The opportunity in India. Raj was leading India expansion for a foreign company that manufactured radiation equipment. The company had strong products. Its machines were already used in different countries. The quality was proven. The supplier was confident, and India looked like the next big market. Hospitals were upgrading diagnostic facilities. Industrial users were looking for advanced testing equipment. Distributors were interested in partnerships, and end users wanted reliable machines with proper support. Raj saw a clear business opportunity. The company could sell directly in India or appoint third-party distributors to reach more customers. Everything looked commercially attractive. But during one planning call, the Indian distributor asked a simple question.
Raj, before we sell or import these machines, do we need radiation safety approval in India?
Raj paused for a moment, because he realized that selling radiation equipment in India was not only a commercial decision, it was also a safety and regulatory approval journey. Chapter 2. Why radiation equipment is different. At first, Raj thought the process would be similar to selling any other medical or industrial equipment. Find a buyer, appoint a distributor, ship the product, install the machine, start operations. But radiation equipment is different. It may be used in hospitals, diagnostic centers, research facilities, industrial sites, or other controlled environments. And because it involves radiation, safety approval becomes important before the equipment reaches the Indian market or starts being used by an end user. Raj understood the practical concern. The issue was not whether the product was good. The issue was whether the product could enter India, be supplied, installed, and used under the correct radiation safety framework. That is when Raj decided to consult an advisor. Chapter 3. The advisor explains the approval route. Raj decided to consult an advisor who understood radiation equipment approvals in India. The advisor first understood the full business model. There was a foreign supplier. There could be an Indian importer. There may be third-party distributors. And finally, there would be end users, such as hospitals, diagnostic centers, laboratories, or industrial units. After the discussion, the advisor said,
Raj, for radiation equipment in India, the approval journey is generally connected with AERB.
Raj asked, "What is AERB?" The advisor explained, AERB stands for Atomic Energy Regulatory Board. It is the authority in India responsible for radiation safety. Its role is to make sure radiation equipment is supplied, imported, installed, and used safely. Now Raj understood. This was not only about selling equipment, it was about building the right approval chain. There may be supplier authorization, there may be product or type approval, there may be an import NOC, and the end user may also need approval before installation or use. Chapter 4. The full chain becomes clear. The advisor explained the journey in a simple way. If a foreign company wants to sell radiation equipment in India, the supplier relationship must be clear. If an Indian company is importing or distributing the equipment, proper authorization may be needed. If the product is entering India, the product approval or type approval route must be checked. If the equipment is being imported, an import NOC may be required. And if the equipment is finally installed at a hospital, diagnostic center, laboratory, or industrial site, the end user must also be ready from a radiation safety point of view. Raj realized that AERB approval was not just one formality. It was a connected chain between the supplier, importer, distributor, and end user. If one link was missing, the entire business plan could slow down. Chapter 5. The common mistake. Many businesses make the same mistake. They first appoint a distributor, then they promise delivery timelines. Then they start import planning, and only later they ask about radiation safety approval. By that time, the customer may already be waiting. The shipment may already be planned. The distributor may be under pressure, and the end user may expect quick installation. Raj understood the risk. The product may be excellent, the market may be ready. But if AERB approval planning starts late, the business can face avoidable delays. The advisor told him, Raj, in radiation equipment business, approval planning should begin before sales execution, not after. Chapter 6. Raj Market Entry Plan. With the advisor's support, Raj changed his approach. He did not rush into selling. First, he mapped the supplier authorization. Then he understood the product approval requirement. Then he checked the import NOC route. Then he planned how distributors and end users should be guided. Now, the business had clarity. The foreign supplier knew what was required. The Indian distributor knew what to communicate. The importer understood the approval route. And the end user knew that installation and operation would also need proper safety compliance. Raj felt more confident because the India entry plan was now structured. Chapter 7. Raj's Real Lesson. Raj learned a simple but important lesson. Selling radiation equipment in India is not only about finding customers, it is about entering the market responsibly. A foreign supplier, importer, distributor, and end user all have important roles. Supplier authorization, product approval, import NOC, end user approval, and ongoing AERB compliance should be planned properly. When this is done correctly, the business becomes smoother, safer, and more reliable. AERB approval is not just a regulatory step, it is a trust-building step for the Indian market. Chapter 8. How SKMC Global can help. Just like Raj, many foreign suppliers, importers, distributors, and end users want to deal in radiation equipment in India, but are unsure about the correct approval route. They know the product, they know the demand, they know India has a strong market, but they need clarity on AERB approval, supplier authorization, product approval, import NOC, end user compliance, and ongoing regulatory support. At SKMC Global, we help businesses understand and manage the AERB approval journey in India. From advisory and application support to supplier authorization guidance, product approval coordination, import NOC support, end user compliance guidance, and ongoing regulatory assistance, our team helps businesses move forward with clarity and confidence. So if your business is planning to sell, distribute, import, install, or use radiation equipment in India, make sure your AERB compliance foundation is strong from day one. Book your free consultation with SKMC Global today.